Hi, this is Steve Rowe, Executive Director. I'm recording this video on Wednesday, March 2nd. It will be uploaded and available to you on Thursday, March 3rd. I apologize for the one-day delay in our process this week, and we'll actually start as of this week publishing these videos on Thursdays rather than Wednesdays. That's a result of just a little bit of a change in workflow for us. We very recently hired a marketing assistant who will be working part-time with Kim Herring, our marketing director. Leah Johnson started work with us yesterday. She will work Tuesdays and Thursdays. So one of the things that Leah will learn how to do tomorrow on Thursday is how to edit this video and get it uploaded for you. So again, I apologize for the one-day delay. Going forward, we'll do these videos and get them to you on Thursday rather than on Wednesday. The big news this week is that on Monday, we made the decision to take masks off within the building. On Sunday, Kim had seen on Facebook that the city of Iowa City was changing their indoor mask requirements as of March 1st, which was yesterday. When Kim and I looked at the CDC information that was available, one site or one source still showed Johnson County as being in a high transmission county. And then another source of information, also from the CDC, showed us as being in a moderate transmission. So red versus yellow. And the recommendation for yellow counties is you are no longer required to wear, or it's no longer recommended that vaccinated people need to wear masks indoors. So we communicated that Monday afternoon, and a lot of people around the building on Tuesday, you probably noticed, weren't wearing masks. There's also some staff members and some residents who will continue to wear masks. And I just want to encourage you to do what is right for you. And again, the recommendation currently with the county transmission level at moderate is that masks are not required indoors. For myself personally, even though I knew that the next day we would be changing our mask requirement, I was at the Iowa men's basketball game Monday night, I was wearing a mask. When April and I went out for dinner last night, it's like walking through to get to our table and even placing our order with the server, we were wearing masks, and then we took them off as we were eating. But it really is up to you at this point. Do what you are comfortable with. And if I would still recommend, if you're in a large crowd, to make the safe choice and put a mask on. We've kind of gotten used to that over the last couple of years. It's not that big a deal, and we just want everybody to be as safe as possible. Actually, it's like, let me skip ahead here. For the last month or so, it's like actually for the last, since Thanksgiving time practically, we had been testing employees and staff, employees and residents on Wednesdays. Was our testing day for employees. Residents testing day was Mondays. For the last 2 weeks, so last Wednesday and then again today, we have not needed to test employees. And we haven't tested residents for the last 2 weeks as well. We got to that point because we had a full 2-week period without any new positive tests. And the only thing that will change that at this point is if we have somebody who is symptomatic, either a resident or an employee, we would need to test that individual, and if they test positive, then that would kind of kick off our normal weekly testing routine again. But we're very, very happy that over the last at least 3 weeks now, we haven't had any new positive employees or residents. So that's been good. I do need to tell you that in the last week, there are 2 independent living residents who have tested positive. Both of them were just very mildly symptomatic, have been quarantining, and will continue to quarantine until their required number of days has passed. We've been very fortunate in that any of our independent living residents who has tested positive since really the holidays has been relatively mild symptoms and have fully recovered. So we absolutely expect this in the last 2 cases that we've had. I looked at the CDC data source this morning for how things are going in Johnson County, and for the most recent 7-day period, so now the data is reported in 7-day increments rather than the 14-day increments that we had been using prior, but for the 7 days ending February 28th, the total number of cases in Johnson County was 241, so on an average daily basis over the last week, it was at 34 new cases per day. That is significantly down from the peak that we experienced in mid-January. We had been up to over 400 new cases per day, and it's also down very significantly even from a week ago. So hopefully that trend will continue, and we'll continue to be lower and lower to where we get back to virtually no new cases. It was great to resume in-person programs and in-person dining last week. I hope that you all enjoyed the candlelight dinner, and thank you to the residents who planned the semi-annual remembrance program last Wednesday. I thought that was a beautiful way to resume our in-person programs. It was also fun to introduce all of the new residents to the Oaknoll community, and then Kim and I talked a little bit about our strategic plan for the years 2022 through 2024. If anyone is interested in having a hard copy of that strategic plan document, we handed them out at the meeting. I realize if you were at East, I didn't think ahead well enough to have hard copies there for anybody who was watching at East. But I do have a lot of hard copies still sitting on my desk, and we'll be happy to get them to you. Just let me know that you'd like a copy, and we will absolutely get that to you. Over the coming weeks, we're looking forward to kind of getting back to a normal program schedule and continuing to expand our in-person dining hours, and eventually here shortly get back to reopening the Third on Third restaurant in the Spring building. It's really hard to believe that we've spent most of the past 2 years thinking about, worrying about, planning how we're going to live with a virus that 3 years ago none of us had ever heard about. I'm incredibly grateful for the trust that you've placed in us as we've tried to navigate our way through these last couple of years. And I was very, very proud of our community and being able to keep COVID out of our resident population for as long as we did. It felt like a major defeat when we had our first positive case. But in reality, it's like with the volume of cases that were all around us, I guess it was probably inevitable. I am very happy that we did not have really any complications, significant health issues from many of our residents who did test positive through these last couple of months. You all have taken incredible care of yourselves and each other. So thank you. I'm proud of what we've accomplished together, and very, very happy that we have not experienced the losses that were so common with senior living communities and nursing homes across the country and even across the state of Iowa. So thank you for all of your work in keeping each other safe. Want to thank you for all your support. I wish you well, and we'll talk with you again in a couple of weeks. Take care.